Well, good afternoon, everybody. I'm absolutely delighted to be here with you this afternoon. Gosh, 400 people. This is absolutely fantastic. And as Ruth says, if all of you go out of here having taken just one thing that you think, I want to think about that, I might want to do something about that, and then share with others, it's amazing how the ripple effect can actually bring about change. So I always say that at my CNO conference in the summertime, so I absolutely echo what Ruth has said here. I'm really pleased that we're here celebrating. We have much to celebrate. And I don't know about you, but I often get a little bit despondent when all the media stories we hear is always about problems or money or something that's going wrong. And we forget that most of the time, actually, we do a blinking brilliant job, and we should take a pause to reflect and celebrate. So it's really great to be here today to talk about celebration. Now, one of the things that I've been involved in this year is to do some work with the World Health Organization. And for me, sometimes you don't quite realize the journey that you've been on and the evolution that the nursing midwifery professions have been undergoing for many decades now, until you step out of the country. For some of you, that might be stepping into England. For me, it was to step out and do some work in the European region. And the work I was doing there was to help finalise and then launch a new strategic directions for nursing and midwifery towards Health 2020, which is the public health strategy for Europe. And this is the first time that the European region has committed itself to have an action plan. It has specific objectives over the next 5 years for us to work on. Now, the thing that makes this important for us, it is, if you like, a marker in the sand to say, do you know what? Nursing and midwifery is really important to the health and well-being of the population of Europe. And if you are able to mobilise that very, very large workforce, and we're probably talking in the region of 6 million workers that have some contact under a categorisation of nursing midwifery, 6 million people plus. If you can mobilise them, ensure that they have proper education, have the right work environments, have the right career structures, have the right support to build the evidence base, to be creative, you can do a heck of a lot to actually improve the health and well-being of the population of the region. So for me, coming into contact with nurses and midwives from across Europe has really made me reflect actually on the journey that we've been having here in Wales and as part of the UK. In fact, a lot of the nurses and midwives I come across actually look to us as the clinical leads, as the exemplars they are trying to emulate, to work towards. In one country, I was talking to the chief nurse there, and I said to her, well, you know, nurse education in Wales, we've been at degree level for over a decade now. We do a lot of work in ensuring that there are proper educational standards. And she said, well, in my country, we haven't got any nurse teachers. Nurses are taught by doctors. And it reminds me how far, actually, some of my counterparts in other countries are going to have to go on this evolution. So I thought I would just pause, if you like, to reflect on some of our achievements, because that's what the people in other parts of Europe are looking to us about. So I mentioned the fact that we were the first country to go all graduate preparation for nursing midwifery. We still have the lowest attrition rate of any of the 4 UK countries from our pre-reg programmes. We were the first country to set up a framework for advanced practice for nurses, midwives, allied health professionals and paramedics. And as of April this year, I've had full compliance across Wales. I wrote to everybody and they said, yep, we now know exactly what an advanced practitioner is. We have clear understanding what the education is, what their role is. And they are now, if you like, the evidence base of the contribution of advanced practitioners is coming to the fore. We see them leading in patient pathways. We're improving the way that we deliver care. When we introduce consultants, health professional consultants, back in 2000, we were the first country to set standards. Those standards still exist, so we have a consistency of approach. They're proper clinical academics and giving us strong leadership in how we drive services. We are the only country that's been doing national audits around fundamentals of care, and we have been learning from that. If you think of things like the continence bundle, oral health and hygiene, lots of issues around the basic care that we need to get right. those core things that the people using our services really value, we've been looking at it for a long time and making sure that we respond and drive improvements. Our 1,000 Lives programme was a campaign to start off with and then turned into a service improvement programme, which I'm sure has touched practically every single one of you, has actually improved people's lives and probably saved lives. If you even think about things like the sepsis bundle that we introduced, being able to identify significantly deteriorating patients early means that we are saving people's lives. Of course, there's more to do, and I don't want to suggest in my little list here that everything in the garden is rosy. By all means, we have lots more to do, but it is worth pausing, I think. I mean, you are part of a relationship with Cardiff University, and I'm really pleased to see that in the next few months they will become the only research collaborating centre in the World Health Organization for midwifery in the Northern Hemisphere. So that means that people are going to be looking to Cardiff, looking to Wales to give leadership around the standards of education for midwives, looking at some of our practices here. And that's down to the work of you here in Cardiff. That's absolutely fantastic that we are seen as an exemplar in that area. We have staffing principles for medical and surgical wards. I know I am absolutely hated by the finance directors. I appreciate that. However, having worked with the nurse directors on some of these things has got a set of principles that ensures that we are safe in what we are determining as the right staffing levels for our units. And we have a suite of workforce tools that will be introduced over the coming years that will help in that decision making. Now, I could go on. I'm sure there's lots of you thinking, well, she didn't give my bit as an example. What I'm trying to say in this short speech is that we've got lots to celebrate. So what do we need to do next? This is kind of so far is a bit looking back. Well, looking forward, we are a country that have adopted the prudent healthcare principles. They were refined in the summer, down from 5 to 4. I'm sure all of you are familiar with them, but just to remind you. So it's about achieving health and well-being with the public, patients and professionals as equal partners through co-production. Care for those with the greatest need first, making the most effective use of skills and resources. Do only what is needed, no more, no less, and do no harm. Reduce inappropriate variation using evidence-based practices consistently and transparently. Now, who could argue with those principles? Absolutely. I have to say, when I was asked, so what's the nursing midwifery contribution then, Jean, to prudent healthcare? Give us some examples about what we're doing. How could you exemplify this? Actually, there are not that many examples I can pull upon. We often refer to things like our National Lymphedema Service, which is a nurse-led service across Wales. It's the only one in the UK. Made massive improvements to patient care and has actually enabled some people who had chronic conditions to have their lymphedema properly managed for the first time to live full and healthy lives. In the prudent maternity services work I've been doing, we're trying to drive normalcy. If you look at the NICE guidance, it talks about up to 45% of births should be normal without any medical intervention at all. We're nowhere near that. If we're half of that most of the time, I would be surprised. So what we need to think about is more midwife-led services. We'll need to have proper leadership for that. We'll have to have proper services designed with that in mind. We need to think about having bespoke packages of care. And one of the principles that I'm most interested in is around working in co-production. And for those of you that came to my conference in the summertime or went to the clinical leadership conference just a fortnight ago, there was an excellent example of a bespoke care package of a young lady. She's name is Katie. Some of you may know this story. She lived at home with her parents, had profound learning disability, physical disability, and the health board, working with the family, with her parents, with a range of other services, have enabled this lady to move into residential care. They have trained the staff in the residential home to do things like peg feeding, to give her normal medicines that her parents were managing. It has stopped her going into a care home. It has stopped the need for a district nurse to visit her 4 to 6 times a day. equivalent of a whole-time equivalent person, and has saved £210,000. The money and the rest of it is actually irrelevant. What is most important is she's living a very full, quality life in the residential home, going out with her friends, being able to live independently, rather than being put into a care home with older people at the age of 33. Now, that's the sort of prudent approach. We need to work with parents, with families, with the individual, to have the care around the individual and be properly person-centred. I could go on, but actually, I haven't got much to go on with. There are very few examples for me to pull on. And if I was to ask each and every one of you here, give me an example of nursing midwifery prudence, I think we might struggle. So what I'm planning to do later in December is to have a strategy summit, if you like, with the nurse directors, assistant directors, and a few other folk to say, okay, what is the nursing midwifery contribution to prudent healthcare? What is it we should be doing? What kind of approach should we have? How do we motivate and apply our minds to this particular workforce? So I would like to encourage you to think about what prudence means to you. I'd particularly like you to think about what co-production means. It is a different way of us collectively thinking, and I think for nurses and midwives, yes, of course, we're very person-centred. That is our raison d'etre. However, our traditions tend to be to do for people, not with people, a lot of the time. So instead of service users coming to wherever it is we work and us saying, so what do you need? What are you eligible for? What can I do for you? We should be saying instead, so what does a good life look like for you? What strengths can we build on? And how can we work with you to achieve your health goals? It's a different way of phrasing our conversation, and it's something we're going to have to get to grips with, to be honest. It's a different mindset in the way we deliver things. Listening to our patients, learning, and making sure we respond to what we hear is absolutely vital. I cannot overemphasize this. I'm sure your health board pays a lot of attention to this, and you do this in your day-to-day work. But there are some opportunities coming along. Revalidation, as you know, last week the Nurse Midwifery Council made a decision that nurses and midwives will be having the new model of revalidation come their way next year. Hopefully all of you know where in the 3-year cycle you all are and who is going first. We've been having sweepstakes in work. I think we've got somebody that actually goes in April of next year, so they're quite pleased. I'm going in October, 3 years' time, so I'm very pleased, because everybody else will have worked out how to do it by then. But it is an opportunity. Revalidation is about reflecting on our practice. It is about thinking about how we act, how we respond to our patients, and what we do. So I do, and I take this opportunity to encourage you to fully embrace revalidation in all the things that it's trying to do, which is to get us to think about our code of practice, what it is to be a professional, what it is we're trying to achieve with our patients, and doing with and not to them. I hope you have a fantastic rest of the day. I'm so sorry I can't be here with you. I know time is a smidge ahead of us because we started a few minutes late, but I am happy to take a couple of questions. I don't know if I've got any answers, but I will have a go. I hand you back to Ruth. Thank you very much for your attention.